Okay. Well, thank you very much for that introduction. And yes, I'm contacting from Geneva, and just very quickly introduce myself. So I'm Greg Perry. I'm the Director General of the Global Self-Care Federation, which is an industry association consisting of the companies and the various national associations throughout the world, which focus on self-care and self-care interventions. And by self-care interventions, basically mean a whole range of products for prevention, for management, and for treatment that are usually available at pharmacy level, sometimes retail level, but cover a whole range from vitamins, minerals, supplements, to oral health, to tobacco cessation, to allergies, to women's health, men's health. So it covers basically the whole range. And what our aim is to do is to help people through these interventions, through access to these products, to enhance self-care and self-management. And we believe passionately that this offers two things. One, it actually empowers people to look after themselves and their health, both through prevention and treatment. And it's probably one of the most effective ways of doing this. And secondly, by enabling people to have access to products that help them self-care and self-manage, it's also going to free up the public health system and the health systems in general. And providing that headroom for primary healthcare, we think is absolutely fundamental, particularly in this time and age where so much pressure is being put on the healthcare systems. We have members from Africa, principally from South Africa and from Kenya, but from elsewhere on the continent as well. And in my previous position, I worked for the Innovative Industry Trade Association here in Geneva, where I was responsible for the Africa engagement strategy. So that's enough about me and about my association. Let me introduce our esteemed panel. First of all, I'd like to welcome Professor Hassani, who is the Assistant Minister of Health for Projects and Public Health Initiatives at the Ministry of Health from Egypt. He's also an Associate Professor of Infectious Diseases. Very significantly, the Executive Director of the National Committee for the Control of Viral Hepatitis. And I think many of us know what an amazing work Egypt has done in the area of hepatitis. Professor Hassani is very well known in Geneva circles. He is one of the most active members from a ministry that I know in the Geneva environment. He is a voice for self-care. He's a voice for neglected diseases. So it is absolutely wonderful that we have Professor Hassani here today. I'd like to also welcome Dr. Deepa Maharaj, who is Global HCP Strategic Catalyst of Opella, an expert in regulatory science and science. And what I like is that Deepa's passion is to make science accessible. Science on its own is no good. We've got to make it accessible for people. And that's clearly a main part of the profession there. Also delighted to invite Dr. Chibito Opara, who is the co-founder and the CEO of Drug Stop Nigeria, which is an innovative pharmaceutical platform to accelerate access to medicines and self-care interventions, and also as a platform to combat substandard and falsified products, which, as we know, are unfortunately extremely high penetration on the continent. And this is done through, increasing transparency and securing the supply chain. And of course, Dr. Shahan Modley I'm very much welcome as part of the panel to have time. So look, I am going to now, I think all our panelists should be on screen. And I'm actually going to first, we're all on screen there? Yeah, okay. Is Professor Hassani there? Great. Professor Hassani, good to see you online. I've got the first
Apologies,
question
Greg.
actually ready for you.
Greg, apologies. If before we dive into the panel discussion, I think it would be really helpful to get a brief context setting from Dr. Moodley. Then we'll dive into the panel discussion, if that's all right.
Please, Dr. Moodley, go ahead. I was asked to go first. I wondered if you were on screen or not, so apologies. Please
He's here.
get us into
Perfect.
the context, and then I'll go on.
Thank you.
Thank you very much. Let me get my slides up. Just a few slides to present as we try and set the scene for today. It's an extremely amazing panel to be on, so I'm really grateful to be here. I'm going to switch my camera off, the video off, so that you get a better quality sound. The bandwidth is not great here in Durban today. So firstly, thank you to the African diaspora and Opella Healthcare for this invitation to set the scene in this important discussion as we continue to explore and strengthen scalable solutions in the self-care environment. I bring you greetings from the International Pharmaceutical Federation, my organization, the Independent Community Pharmacy Association, and of course from everyone in the southern part of Africa, and especially my hometown in Durban. As we move to my next slide, it is critically important to note that 3.6 billion people, which is half of the world's population, lack access to essential health services. We are duty-bound to better support our populations as we face the spiraling healthcare costs, poor health outcomes, and continued health disparities. To reach universal health coverage, to promote health and well-being, and to keep the world safe, and to serve those in need, we do require a dynamic shift in how we deliver care in the future. Self-care has the potential to help solve some of the world's most pressing macro public health challenges, including the pursuit of universal health coverage, the prevention and management of chronic conditions, and the provision of high-quality health care. My next slide. So self-care refers to the deliberate and voluntary action taken by an individual to maintain and improve their physical, emotional, and mental well-being. It really focuses on promoting and maintaining well-being, preventing disease, and coping with illnesses. The goal of self-care is to help individuals manage stress, reduce the risk of illness, and enhance their overall quality of life. A collaborative approach, as introduced in the beginning, that includes all healthcare providers and policymakers is essential in closing the gap between consumers' desire to practice self-care and their functional ability to do so. In my next slide, over the past few years, self-care has become a top priority at FIP, as reflected in our policies, publications, and educational priorities through webinars and at our conferences. Every attempt is being made to leverage the pharmacist's expertise, accessibility, and trusted relationship in the community. Through pharmacy, we have provided quality, evidence-based scientific information and advice on self-care behavior, including products and services, to the public to promote health literacy and to empower people towards better health and well-being. In my next slide, this FIP statement of policy on pharmacists' gateway to self-care was launched in Copenhagen at the FIP World Congress in September of 2025. While the policy recognizes the personal responsibility of patients in self-care, it emphasizes the key role and the responsibility of the pharmacist to promote, inform, and support patients in self-care activities. Self-care must become one of the strong pillars in our healthcare armory so that we can efficiently use our limited health resources to deliver and contribute towards universal health coverage. Patients with limited health literacy or low self-care confidence often rely more heavily on healthcare professionals, accentuating the need for accessible and inclusive pharmacy support. The next slide, which also deals with the policy issues, and this supports, if you move on to the next slide. Thank you. So have you skipped a slide? Okay, the policy supports improved health literacy as a key strategy. There is evidence to suggest that improved health literacy leads to greater use of self-care, which contributes to easing the burden on any country's hard-pressed health services and associated budgets. The evidence indicate that support provided by pharmacists and other healthcare providers for self-care adds direct value to patients and shifts towards a more patient and person-centered approach, which is a fundamental principle in healthcare. In the next slide, this slide really outlines the FIP multi-pronged strategy, which is an approach to self-care, which includes, firstly, addressing inequalities in health literacy and advocating for self-care to be included as part of the pharmacist health benefit offering across all countries, ensuring that self-care modules are included in healthcare professionals' training curricula and their CPDs, daily CPDs, making the best use of the expanded community pharmacist consultation services, and this includes improving access to effective pharmacist-initiated treatments, enabling community pharmacists to refer directly to other healthcare professionals, and to ensure better support for primary healthcare networks to deliver self-care. There is certainly additional now focus on the use of technology and efforts to accelerate and enable community pharmacies to populate medical records of patients. In my next slide, there's indication that there are huge opportunities for pharmacy. We encourage you to start that conversation around appropriate self-care, be it for treating minor ailments, chronic disease management, or in the preventative space of health screening, vaccines, and lifestyle modification. Next slide. So a key focus for this session, obviously, is health literacy and financing. So to support health and medication literacy, what we need to ensure is that you check patients' accessibility to and the use of communication modes, use plain language in patients when you refer in terms of language ability, use decision aids and visuals, explain your reasons for following those important information that you are offering them, use teach-back sessions to access patients' understanding of what you've just discussed, and invite patients to use a question and answer system. Next slide. So a sustainable financing model demands that more is spent at a primary care level in order to reduce the escalating costs seen in tertiary healthcare. This will ensure more people have access to care at the bottom end of that triangle, and this will promote health equity across all nations. Our plea to governments is that they need to invest in self-care models, open the door for private-public partnerships, and ensure equitable reimbursement models for healthcare professionals and service providers alike. Next slide. So on International Self-Care Day, and you can take a photo of this and link into it, FIP launched this resource to provide evidence-based recommendations for implementing self-care approaches that supports the prevention and control of non-communicable diseases. In the next slide, we talk about these FIP resources available in the area of self-care, and this can be accessed through both the FIP library on the FIP website or on our very dedicated microsite that is very easily accessible on the FIP site. And I think that might be my last slide, and I can revert back to the organizer. Thank you very much for listening.
Thank you so much, Dr. Moodley. Greg, back to you.
Yeah, Dr. Smith, thank you very much. And I think that that presentation clearly provides the whole context in which this discussion is taking place today around around self-care. And I think highlighting those two aspects we noticed about that empowerment of people in their own health, but also the question of the financing as well. And that empowerment of people, health literacy is a key part of that. So let me now go over to Professor Hassani. We'll kick off the discussion here. And the question, Professor Hassani, I have for you is, how can self-care be refrained from a private or personal act to a collective health strategy that empowers the individual while strengthening the public health systems? And obviously, from your own point of view and your own experience, it would be great to hear your viewpoints on that.
Well, thank you very much, Greg, and thank you for the African Diaspora Network and Opella and Global Self-Care Federation for convening this important meeting. And actually, you know, colleagues, Greg is one of the global champions we should all be proud of, as his efforts and leadership are instrumental and serve as a true catalyst for the global initiatives of self-care and their effective use across the different healthcare aspects and challenges. And I would say he's carrying on his shoulders the burden of raising awareness of self-care and its effective integration into the daily practice. So thank you very much, Greg, for your remarkable efforts. And again, coming to your questions, it's very important that you know, the idea of the raising the awareness and the importance of the integration of self-care is quite fundamental. Now, the primary health challenge of a lot of continents is the non-communicable diseases and also infectious diseases in certain continents like us in Africa, which is actually squeezed between infectious and non-infectious diseases, and they threaten to undo decades of progress by affecting populations that are younger and more economically active, and tackling them requires more than hospital capacity or advanced treatment. It requires a kind of a shift from the episodic care to continuous prevention, and self-care is central to this important change. Self-care actually is what turns prevention from a policy ambition into a daily practice. And when individuals understand their risk factors and monitor their key indicators like the blood pressures or glucose level, and follow their prescribed treatment and adopt a kind of healthy lifestyles, we move upstream in the disease curve, from just treating complications to preventing them altogether. And these small, consistent behaviors are the most potent, from bearing in mind that this is an important showcase of the health investment a nation can make. And allow me just to shed light on some of the local experiences in the integration of self-care into our national policies for the combating a lot of diseases, especially or in particular non-communicable diseases being one of the most important and challenging issues in Egypt. I would say that we have a lot of examples that now apply within the context of the primary healthcare, like the early detection of cancers like breast cancers. We educate women in the age group from 18 and above for doing the self-breast examination at home. And amazingly, we discovered maybe hundreds of cases discovered to have breast cancers through this educational platform of doing the self-breast examination at home. And this enabled us for improving the early detection percentage of cases suffering from breast cancer, as well as when it comes to the colorectal cancer detection, as also we educate people to doing the self-preparation of the stool sample at home using what's called fecal immunochemical test. And this is one of the fundamental diagnostic tools to early detect colorectal carcinoma. And also this enabled us to discover hundreds of cases of colorectal cancer in much earlier stage. The last important issue is that I would say that in a very few days we are start to implement what's called non-invasive glucose monitoring devices for children suffering from insulin-dependent diabetes. And this will enable us for a proper control for the vulnerable cases or vulnerable children suffering from the continuous fluctuation of the blood glucose level and are vulnerable for the complications of the insulin-dependent diabetes. And also this will affect on the rate of the development of complications and hospital admissions of those children. Those initiatives are very important and fundamental from our perspectives. And when it comes to the population level, self-care supports every component of the healthcare promotion agenda, starting from the balanced nutrition, the physical activity, the tobacco cessations, and the mental health and the mental well-being as well. And they are not just personal choices, they are like a public health levers. And I do trust that this time is very suitable for embedding self-care principles into from maybe school curricula, the workplace programs, and the community campaigns, which will help to create a generation that sees prevention as a normal part of life, not just medical instructions. For the government, the lesson is clear. Integrating self-care into the management of a lot or a wide portfolio of diseases is not a luxury. It's a kind of an efficient measure and tool that will ease the mission of different healthcare systems. And every case of like hypertension control at home, every complication is avoided, translated into financial sustainability and more healthier and more productive populations. And that I would say why the World Health Organization now calls self-care as a kind of a cornerstone of the universal health coverage and healthcare system resilience. Last but not least, self-care is where prevention and empowerment and equity meet. When people take the informed responsibility for their health, supported by accessible tools and trusted systems, we build societies that are less vulnerable to disease and more capable of shaping their own health outcomes. Thank you very much, Greg.
So yeah, and we'll come back, I think, to the issue, focus a little bit more on prevention there that you were mentioning. But let me go over to Dr. Opara. I'd also like, maybe the audience would like to hear a little bit about your platform as well. But the question I have for you is how can health professionals, and innovators like yourself, patients, scientists, both in Africa but also in the diaspora, how can you co-create or catalyze solutions to make self-care and health literacy accessible? And your own experience in doing that, I think, will be really very interesting. The floor is yours.
Thank you for that question, Greg. So Drugstock is basically a platform that is built on two pillars: technology, which we've been doing for the last 10 years, and a distribution network. And basically what we do is create access to patients and the ecosystem. And what is fascinating about the last decade in healthcare has we've gone through like a seismic shift in the way healthcare is consumed. Innocuously, a lot of people haven't noticed, but one of the things now that any doctor will tell you is that, the patient, first of all, Googles everything they're going to do before they show up at your office. And after they show up at your office, they Google everything that you told them to do. And then, and then ChatGPT has also driven that whole, so we are in this phase of a new way of, right now, even the doctors are ChatGPT to ensure they cover all bases. So it's a very interesting space that we are at. And I think that is the first thing that I would like to point out, that healthcare is now in a very interesting phase where we do need to co-create the experience of healthcare. And it's never been more important as it is going to be in the next 5 to 10 years, because in spite of these impressive movements, we are also facing a deluge of, just nonsense in terms of health literacy and knowledge sharing. And so we do need to, take a step down from the ivory towers and become more accessible to the patients. We need to bring these solutions, make people understand. It is important for people to understand the why of their treatment and not just the what and the how. So it is important to bring the patient voice as prime in the entire healthcare system. One of the things that, I say every day, and I find myself repeating this every day across teams, across clients, across systems. Patients come to us for health, but we are in the business of pushing healthcare. Now, it might not sound different, but healthcare is a series of solutions. Healthcare is a diagnosis, it's a test, it's drugs, it's an intervention. The patient has a headache. He doesn't know or care about all these things. So meet the patient at his point of need. So we need to elevate what the patient is worried about, and then build an entire system of intervention around it. The other thing is our innovation needs to speak to the local context. It doesn't make sense to bring innovation from somewhere that is, either in terms of how the design is brought, it doesn't meet the patient in terms of geographical access, in terms of time access, in terms of financial access, not necessarily quantum of pain, but also how the patient is able to consume effects. For instance, in Africa, a very interesting dynamic of consumer spending that the big companies have showed us is you sort of need to commoditize, or you need to, how do they say that word? You need to bring every package of consumer spending down to the daily packages of needs. Otherwise, people just won't pay attention to it. If something is consumed on a monthly or on a bulk level, it stays in the class 1 or class 2 socioeconomic groups. It never gets down into 3, 4, 5. So you need to meet patients in their area of where they are, what they need, and sort of bridge that gap between what we have here and the diaspora groups of knowledge that we can also tap into as communities of Africa. And then it is essential that we empower the frontline health workers. They need to be the co-creators of innovation. Innovation is not about going to some lab and coming up with the latest drug, or spending $100 million on some new protein fold, or some drug, or some intervention. Innovation is really bringing it down to the population and saying, can we bring this into the population? An ultrasound that is fantastic but works on sine wave and can only be deployed in the metropolitan cities does not improve access. An ultrasound, however, that and if it brings 4D images, that's wonderful. But then that's wonderful for just the 50 patients who get to use it. However, an ultrasound, which is rugged, lasts 36 hours on battery power and can transmit very little packets of data, can increase access to ultrasound studies for over 50,000 patients, because it can go to the patient and meet them in their area of need. And the surprising thing is the incremental technology to create access is not really a financial decision. It's more an empathy decision. It's understanding the patient and the patient needs in their local context. And I think over the next 5 to 10 years, that is what access building and intervention and innovation in the African space would look like. And yeah, I'm excited about it.
I can feel the excitement in your voice when you're talking there. So, and I think that's what draws a lot of people at the moment on the self-care area, is this, with the AI, with people having greater knowledge, we can address also the false knowledge that comes around. This is the time for people to be empowered, yeah? And so it really is the time for self-care, which really leads me over to yourself, Deepa. And the question I have from you was, and it follows on from what we were just discussing, what practical models and communication tools can make health literacy, if we want to still call it that, health information, accessible to people? And as was mentioned, what tools do we need? Because we've got to access different languages, different cultures, different levels of education, people living in rural areas, people living in metropolitan areas. So how can we create those tools so everyone can be informed, and then everybody also can have access? And how is Appella part of that movement?
Thanks, Greg. I think that's such a topical question, because honestly, the self-care revolution is already here, and I think we're already late to the party. If you look at the studies globally, WHO has already said that 60% of the world's population struggles to understand basic health information. So you can imagine, with that burden on health information, the job really is to make health literacy and the science driving health literacy, as my learned colleague said, as simple and translate it into the language that people know, so people's daily language. And I think that is what Opella is obsessed with. Our obsession is really to make self-care simple as it should be, so that people and patients and communities can make the best self-care choices for themselves. And in order to do that, we start with really simplifying the science behind our brands. And powered through a very simple science formula, we translate our science and make it more accessible through QR codes. And I'm sure we've all seen this boom of QR codes on our OTC packs, on our prescription packs. But that truly connects patients and communities with their brands at any time through mobile devices, which are the most accessible platforms available. And studies have even proven, Greg, that when you allow patients access to information in very simple terms, it doubles their comprehension. They're able to understand and take better self-care choices. So studies recently run in Malaysia, through the Malaysia Health Authority. We've had studies done in Vietnam, in Italy even, that showed these double-digit growth in comprehension. So imagine that scale of doubling health information, health understanding, how it can really empower patients to take the right decisions. The other way is to ensure that we use digital tools properly. We need to ensure that the voices empowering those also have the health literacy tools they need. So now I'm talking about the HCPs, the healthcare workers that my learned colleague also mentioned. They also need to be educated. They also need access to solutions that they can then use to meet the patient's needs. And in Opella, this is something we've committed to. Through partnerships with national and global associations, medical and professional, we've ensured that we're able to build insights, gather what exactly is happening on the ground, what are the pain points and what is needed to deliver on these health literacy needs of both patients and healthcare professionals. We then go a step further, and through our roundtables and advocacy boards, we co-create with them the solutions that are needed, so that innovation that is truly localized to deliver on the pain points for that specific population type. And finally, we accredit those solutions so that they can be scaled up to other countries and even taken to more global, mature markets where they can learn from best practices and leapfrog efforts from emerging markets. We have utilized most of these CPD accredited modules that we create with these healthcare professionals and national organizations on platforms where HCPs and patients are present. So we ensure that we go to where they are. And as Dr. Parra said, let's go to where the patient actually is, where the communities are. We use Opella Plus, which is our own global platform. We use Opella Health Hub, our Asia founding hub, and Farm Academy in Amet, which Egypt is a key founding member, to partner with HCPs and patients. And to date, we've reached over 200,000 healthcare professionals and educated them through our health literacy tools. And through our own internal data, we've proven that we can improve their confidence levels to be able to engage with their own patients. So whether it's a QR code, whether it's a 1-minute explainer video, or whether it's pharmacist advice, I think with Opella, we're really trying to simplify science and health literacy so that we can make it accessible, understandable, and credible everywhere and to everyone. Thanks.
Great. I think you used the term co-create as well. I think this is a good one to take out from this panel, this importance of co-creation. I mean, we've got the ministry here, we've got a ministry, we've got a pharmacy innovator, we've got a company. We spoke from, we heard from Dr. Modley, who I just want to give a little bit of an opportunity to comment from a pharmacist, health professional point of view. And of course, we have people, individuals, which we all are. But that co-creation seems to be quite a key part of the way in which we move on. Now, I'm going to open up the floor to those who are participating. But before I do, I'd just like to give the opportunity for Dr. Moodley to comment on anything the panelists have said before we move on. if you're there.
Yeah, thank you, Greg. So it's been an interesting discussion. So I think the step back for me is that our education in terms of how we produce our healthcare professionals uh, needs a bit of a change. It needs a bit of a different kind of concept, because we've been almost training for illness, if you know what I mean. So if we go back a step and re-look at the curriculum development from a healthcare professional point of view, I think the issue of self-care needs to be invested in those syllabuses. And it's what it's going to require is some transformation taking place at that level, some understanding in terms of government policy. And if you start aligning policy then to what the training needs are for a big population like South Africa, for example, then you'll see those changes coming in at that level, at the institutional level. And then how then do we deliver that at a primary healthcare level? We've struggled in many countries with the fact that we've almost, over the last 20 or 30 years, skipped from this primary healthcare scenario that we found ourselves in the early years to this very complex tertiary care. Everything is related to how we move up the ladder and how we invest in these technologies and x-rays and everything else. But I think the second point here I want to make is that from a government point of view, there has to be investment within communities, within districts and sub-districts, so that this concept of self-care and assisting these people and patients to drive in that direction is going to require that kind of change from a government point of view. So I think those are two big things: the training of healthcare professionals and the investment from a government point of view is probably what I would like to add into the equation here. Thanks.
Okay, so I'm going to summarize a few points, but just taking, we've got co-creation, we've got the need to emphasis and the opportunity to emphasize more on prevention, so not training for illness, but training to keep people healthy, individuals to be healthy. We've got these new tools that are available, and the importance of communities. I'm going to hand over very quickly, but I was on a webinar recently, and someone said, look, the role of self-care is to stop people from falling in the river. We spend too much time in health trying to take people out of the river and then deal with them. Our role is to try and stop them from falling in the river. At that point, I'm going to open it to the audience, but I'm going to unfortunately need help from the organizers because I can't see the questions coming up on my screen anywhere. So if I could take a question, or I'll ask the organizers if they have a question that we can give our panel.
Thank you so much, Greg, and thank you to our esteemed panelists. We do have a question from Courtney Cash. It is quite lengthy, so Courtney, if you don't mind unmuting yourself, and maybe, I know it's a question directed to Chibuzo from Drugstock.
And actually, thank you very much. I think this could be to the whole panel. I represent the World Shoe Fund and also a network of organizations using social impact or market-based solutions to try to improve health systems in Africa. Through product development, we've developed an antimicrobial shoe, a sour sock, improved sanitary products that, they're made in Kenya, manufactured in Ghana, made in South Africa. What we're looking to do, and my main question here is, we did the co-creation process. That's what's been successful. And, talking to the people that will be the end users, every community is different. Every country is different. My question is related to innovation to scale. And your thoughts on, and not just through humanitarian, not just through giveaway, like the government of Rwanda, they don't want us to give things away. How, affordability, and we're bundling interventions, health and hygiene kits, your thoughts, your experience on how through the promotion of self-care, you must have access to the products that you need. So if you could just give us some insight on retail growth or affordability of these products and how you scale.
Great question, Courtney. First of all, good job on the shoes and the sock. When I heard that's a mind working, and I love the product lineup that you have there. I'd love to check it out. So basically, right, we've brought a lot of products to market. Naturally, we have over 7,000 retail businesses on our platform, and a lot of them, purchase products from over 300 to 400 manufacturers across the globe, that list their products on our platform. And so I've watched innovation, I would say commercialization cycles. And I think what you have is interesting. A lot of the time, attention is what you're trying to connect to, right? Because it's attention, it's distribution platforms and all of that. There is no easy way. It's I'm not gonna bullshit you and say, there's this magic pill. There is no easy way. One of the things we do on our platform, though, is because we have so our platform has this thing. We have this network called Pilometer, and essentially it runs pharmacy operating systems. So we're able to connect you to our retailers and introduce your product to them, and things like that. Obviously, it's up to them to decide if they want to stock it or shelf it. But the important thing is, one of the things I've seen that work are really educating the healthcare professional on why it's important, like why it would change his practice, how that matters to the patient. Because, every time patients make decisions with their wallets and with their feet, and then the big purchasers also make decisions. So you also need to so I would say you sort of need to have education on different platforms, and it's kind of like thinking about it like a multi-buyer schedule. I know I'm getting too businessy. I'll step back a bit, but you sort of have to think about it on a multi-buyer level. So the communication to get into the supply chain is very different from the communication to use the product. It's very different from the communication to place the product, and it's very different from the communication to pay for the product. And this is the buying chain. That is what it is. It's complex. And obviously, when you do B2G, it's also a different communication and purchasing timeline. So I'm happy to take this offline. I can see I don't want to bore our audience with these technical concepts, but unfortunately, in addition to innovation and science, there is a very real commercial element that needs to go hand in hand, and oftentimes it needs to be. It's just as important as the conversation with the patient. And I'll stop there. Thank you.
Yeah, but obviously the business angle is really quite important to make the whole system work. But I just want to give an opportunity for Dr. Hassani here, because it's not directly self-care, but I'm talking about the amazing work you did in the area of hepatitis C in Egypt. I mean, it's almost unparalleled. Yeah. And that required a big outreach on information to people. It required the public sector working with the private sector. I just wonder if you could give us a taste of that, and how maybe you see a link there also to health information and literacy for people, and then I mean, it was an amazing work that you did there, and also it helped local producers as well.
Yes, thank you very much, Greg, for raising this important item. And again, I deeply trust that when the governments fund and regulate and measure self-care, they do not shift the responsibility onto citizens. They empower them, and that empowerment is what makes, the universal health coverage truly universal, and the access to healthcare services improved. And thanks to shed light on the one of the flagship initiatives in Egypt of the hepatitis elimination that was conducted maybe starting from 2018. But before that, we were one of the countries that adopted the utilization of self-care on the early detection and the discovery of cases suffering from hepatitis E in Egypt.
Okay.
And I do remember that in 2017, we conducted an extensive screening campaign encouraging people to use what's called the oral salivary test for the HSCV detection in Upper Egypt. And it was conducted in 3 of the Egyptian or the Upper Egypt governorates in Egypt. their citizens maybe reach it to a couple of millions. And we discovered 300,000 cases of hepatitis C through the use of this very simple tool of self-testing of hepatitis C through the saliva. And we timely linked them to care. And this one of the maybe important levers for us to know exactly that the people is a part of the solution. You should empower them. You should educate, as my colleague just mentioned, and raised this important item. And again, to make a kind of throwing a stone into the stagnant water and to break the ice of just believing that the people should only receive the information from the healthcare providers and from the governments. No, they are part of the important solution for the challenges that we as government are facing every now and then. And believe me, this also one of the key pillars that enable us when we started the mass screening campaign to go for the tapping on the raising awareness and to talk with the people about the importance of their participation within the mass screening campaign. We received at that time almost 63 million people in the age group from 12 and above to be tested for hepatitis C. And thanks again to shedding light on the importance of the partnership with the private sector, because through this partnership, we succeeded to manage one of the most important devastating diseases that we faced the last couple of decades. And we succeeded to bring the levels of infection in Egypt from the level of 10%. You can imagine that at certain times we have more than 5 million people suffering from chronic hepatitis C. Now are coming to the one of the least estimates of hepatitis C prevalence, less than 0.4%, and Egypt succeeded to be acknowledged from the WHO as the first country achieved the golden tier certification on the path to elimination of hepatitis C. And this is not the end of the story, and we make the same now with the prevention package for the people suffering from the key populations among the packages offered for the HIV prevention package, because now we endorse the self-testing mechanism and self-testing tools, and we offer the vulnerable groups and the key populations those self-test in order and educate them in order to know exactly the situation that they need to use this test, and if it's tested positive, then to go for the nearby treatment center to be evaluated and treated. Again, I would say that the people should be part, as the diseased people is a part of the complexity and the challenges that we are facing, but they are a true fundamental part of the solutions. We should capacitate them, we should educate them, and we should raise their voices and hear their voices as well, and to know exactly that integrating them inside the decision-making process, especially in self-care, is quite fundamental for improving the health indicators. Thank you very much.
I know, thank you very much. Yeah, so indeed, self-testing, self-management, self-care, it's all around the self there. I want to know, because we've only got 3 minutes left, is there one other question we should be taking?
Yes, so I'm going to just package. We have 3 questions and I'll just read them out. First one is from Barbara Simmons on how to begin a collaborative self-care approach between the African American and African communities. She's based in Pennsylvania and had a recent private meeting with Namibia's president. Another question from Hamda is, what is the takeaway of self-care on an individual level? What can I take away as a self-care habit at the individual level? Last question to Professor Hassani and other panelists, curious about preventative measures and models piloted at the local level, for example, where healthcare professionals may collaborate with vendors at testing stations or make available educational materials, etc.
Okay, could I take, because we've only got a couple of minutes, Chimboso and Deepa, would you like to take the first one, more about what collectively Africa and the diaspora could do and work together, and also about the question around a self-care habit, but very quickly, because you got about 30 seconds each, and then the one on prevention. I think I'd like to bring over to Dr. Hassani and to Dr. Moodley. Yeah,
Deepa, you want to go?
Oh, perfect. So, I mean, I think it's a wonderful question because it talks to the entire co-creation and collaboration that we've been talking to. And my call to action to the African diaspora as well as the network that's here. I think it's about starting with insights and a shared insight and shared vision on where you want to go. I think the critical part is making the health literacy as simple as it should be. And if we start with that and the science behind the health literacy becomes as simple, it can translate into easily actionable outcomes. As an example, with Opella, we're partnering with so many stakeholders from regulators, healthcare professionals, national associations, even trade associations like the Global Self-Care Federation and APSMI. In Bangkok, we've set up a forum with 12 Asia Pacific regulators where we're talking about simplifying health literacy to its basics. So I think that is my call to action, is work where the need is, come together on a shared vision and really empower and partner to drive health literacy to the lowest levels and empower the patients and communities to be able to be engaged with that. And Opella as a partner is open to such partnerships as well, as we are also a member of ADN and will be more than welcome to partner with anyone with such great innovative ideas. Dr. Para?
Yeah, I think on the individual level, I love the quote earlier where it's like, doctors should stop, health workers, not doctors, should stop, pulling people out of the river. I mean, not stop pulling people out, but not in addition to pulling people out of the river, we should stop people getting to the river. I love that. And I think everyone should, in their own space, first of all, start to work on self-management, increase the knowledge of that within your own circles, self-management, self-literacy, and all that good stuff that comes around improving self-care. I think it's important. I think strengthening and supporting organizations that are advocating and engaged in this process. When I was in school, they used to tell us, when I was a resident, they used to tell us, see one, do one, teach one. So you've attended one literacy session, do one, speak more about it, and then, teach one, talk to more people to do more of that stuff. And so it spreads. This is more of a behavioral change type of thing than an active intervention. So I can imagine that it's different levers that we will be pulling. But I think once the entire zeitgeist of the world is already on that, we want to be in preventative care. So they are looking for solutions. And I think as healthcare professionals, we do need to give them these solutions before they find them in other places that don't make sense. As a company, some of the things we do through our platform, Pilometer, with our pharmacy operating systems, because we have deep connections through our technology to the manufacturers and these retail businesses, we do promote interventions and activities around things that have to do with microbial resistance prevention, that have to do with rational use of medication, increased preventative care, and things like that. And there's a lot of organizations that we've worked with, interesting ones, that sort of focus on these areas. But I think, from next year, some of the things we're looking at are directly taken from our bottom line to invest in that too, because it is important. And, from a triple bottom line perspective, it does come back. And I encourage every business and every government entity and every non-governmental entity to start thinking in those terms and looking at measuring impact differently, not just in terms of the traditional ways we've measured impact in the last 40 years.
Okay, thanks.
Preventative line, bottom line, like how many lives did we prevent from going to the river?
Okay, I'm going to just leave one short comment for everybody, because we're starting to lose people, I think, because we're on the hour. So if there could be just one short comment from, if I can ask Dr. Hassani and then Dr. Moodley, particularly around the area of prevention, stopping people from falling in the river.
That in the chat, this is one of the important questions coming from Akizi about the prevention, the blended intervention, like bringing the healthcare workers and professionals and the vendors, maybe also the advocates into certain stations or in certain places. I just need to highlight that the importance of this testing pilot should be preceded by a lot of educations. And again, the beauty of that story, that we succeeded in Egypt to manage maybe hundred thousands of mobile units and clinics, and going for different rural areas and border areas, and trying to advocate for certain early detection and screening for certain diseases. But the best practice coming from starting to just to make a kind of a conversation with the people, to educate the people well, and to raise the idea of that we are true partners, the government, the healthcare professionals, the different partners, and the patients. And when it comes to the early detection, the benefit of that early detections would pour finally not only on the governmental perspective, but only on the patient perspective, and detecting diseases much earlier will save lives, make a kind of a cost saving for the government, for the people. So against such kind of a mixed way of service offering for the people, starting from the education, raising awareness, and ended by the testing and early detection. Either those tests are conducted at the sites of the healthcare service offering, or even at home when it comes to the self-test or the self-care for certain areas of certain disease.
Thank you. And Dr. Mood, last couple of words. The pharmacist is going to be key.
No, absolutely. I think more than the pharmacist, the combined effort of healthcare professionals, communities, governments is what's required really in the self-care space. But I think the pharmacist really has an important role to play. And I like the concept of having our populations know their status, whether it's their HIV status, their diabetic status, or whether they have hypertension or not. And I think the issue of early detection and testing is key to avoiding the issue of falling into the river. So I think that's really an important concept. And if you are testing, I also think you need to offer quick and easy solutions when someone tests. If they're HIV positive, you can't let that patient out of your sight after that. You have to offer them a quick solution. And in South Africa, we got the pharmacist-initiated management of ART that has just gone through government, and hopefully we'll get the licenses to practice. There's 1,000 pharmacists that have been trained, and what we're doing is PrEP, PEP, and first-line ARVs. As soon as you tested, you're positive, we're going to offer ARVs as a first-line treatment in pharmacy. So test, treat, and quick solutions for populations is what the answer is. Thanks.
Okay, thank you. I'm going to hand over to the organizers. I just want to say thank you for all the panelists. I really enjoyed it, and we had a good number of people joining, so thank you, everybody. As the non-African, I'm really privileged. I'm very honored to have been part of this discussion, but as we know, all our roots come from Africa, so always enjoy having these discussions. I'll hand over to the organization. Thank you very much.
Thank you so much, Greg, and thank you to our panelists again for such an engaging discussion, and also to our participants on chat, very engaged. I'm sorry we couldn't get to all the questions, but I'll pass it over to Anima from Opella for some brief closing remarks, and then Omalayo from ABN as well.
Thank you so much. Thank you, Greg. Thank you, Dr. Deepa, Dr. Prof. Hassani, Dr. Apara, and Dr. Moodley. Thank you so much. I think overall, what my biggest takeaway here is that we do have a shared purpose, but also so much shared progress as well across Africa and even Asia, where we are at, and the diaspora. We heard today how self-care isn't just a private act. It's not just a public act. It is a shared act for a public good, right? And so from pharmacists to the front lines, to people bringing products to shelves, to governments enabling self-diagnosis, education, and access, and designing new financing models, all of us have a part to play in building systems where we can change take charge of our health and prevent people from falling into the river. I think it's a really important to consider innovation with inclusion and meeting the patients where they are in their point of pain and their point of comprehension, and even in the point of treatment, like Dr. Moodley had emphasized. And it's really a through line, which everybody, as I mentioned, also plays a part in terms of making healthcare literacy inclusive, not just in comprehension, but also in implementation, right? And so when we bring the science to the community at a scale, we create trust, we create a foundation of a sustainable healthcare. And lastly, a call to action for everyone who's witnessing today, and everyone who also participated in the panel. It can happen when we pull together. We reach distances much farther than we anticipate when we're all pulling towards the same direction, right? And so we can co-create, we can invest as companies and as active advocates. You learn one, you do one, you teach one, and you advocate for another one. I would add another one. You advocate for another one, right? To make these solutions that put health in the hands of the people who need it the most every day, right? And so for us, it's not just a mission in Appella, but we hope it's a movement that transcends regions, that transcends like the African diaspora reaching the world. We hope that healthcare also reaches the rest of the world, especially those who need it the most. So I hand it over to Omolaya. Thank you so much for letting us be a part of this.
No, thank you so much, Anama. It's been such an honor collaborating with you and our wonderful panelists. Anama and I were chit-chatting in the side chat, like what a beautiful and rich and diverse perspective all of the panelists brought to this conversation. I think Greg picked up on this as well, how we had such different contexts from all the panelists and our context setter. So I just wanted to give a big round of applause to our speakers. Thank you all so much for your time, your effort, your expertise, and most importantly, the work that you all are doing in your various spheres to keep people out of the river. That visual lives rent free in my head, Greg. Thank you so much. I think that is such a beautiful way to quickly describe what we are all trying to achieve. And I think everyone here, I can tell from I'm just bummed that we're running out of time. I can tell from the engaged questions and even just the I'm working on this and I'd love to connect on that. That's happening in the chat, how engaged and committed all of us are to this work. And so I just want to, in addition to applauding our panelists, applaud everyone here as well who is committed to the health of their community themselves and the globe. I really liked what Chibuzo said around self-management and literacy and just being able to start with yourself as far as being knowledgeable about the health that you have access to and you're able to do. I think Dr. Sham said as well about tests being available and then solutions being available as well, because I think knowledge is power, and that includes knowledge of your healthcare status and your self-care status as well. So I think Anima already summarized it so well for us about the really important takeaways here, and particularly the personal responsibility that we all have in the fight for self-care and healthcare globally. So just want to continue want to encourage us all to do that in our personal spheres, our professional spheres, and then wherever we can. I think a few of the panelists mentioned the way that we should support those who are also working on this, right? I think it was Chibuzo, he said self-management and literacy, and then support those who are doing the same thing. So absolutely, absolutely. And here at the African Diaspora Network, we want to just continue create having this platform that allows all of us to say, hey, I'm working on this, and hey, I'm working on this, because when we go together, we go much further. So just, thank you all for contributing to that. And then I think to kind of just close us off a bit, as far as next steps, we will absolutely send this recording to everyone. I think Fatima has left several links in the chats for people's LinkedIn. The speakers' LinkedIn's are all in the chats, and everyone who's still here, like, wonderful. Most of you are still here, so that's really incredible. So we'll wrap up shortly, but, feel free to drop your own LinkedIn, your own contact in the chats, because how we do this together is by getting to know each other. So please go ahead and finish your connections in the chat and get to know each other. And I encourage you to, take one action step after this call. So whether that's just the simple one that Chibuzo gave us about, see, do, teach, and then advocate, like Anima said. If that's your only action, great. But if you can take it a next step further and reach out to somebody on this call, be like, hey, let's collaborate. I know Bidemi asked, hey, how can I get in touch with Opella? Bidemi is an ADN alumni as well. So Bidemi, send me an email and I'll try and put you in touch, at least with Anima, and then maybe she can open the doors wider for you from there. So you're definitely in the right room for that. Barbara, thanks for leaving your email. And then just to finally close off, I did want to let you all know that, we're going to be continuing this conversation. This collaboration with Opella is part of, their series on, African science and diaspora science for healthcare, for health innovation on the continent and globally. And then this is also part of ADN's strategic priorities to go beyond remittances, right? In what ways are the diaspora supporting the growth and development of the continent and the communities the diaspora lives in? And our commitment to self-care, self-management is part of that. What else can the diaspora be doing? A lot of our remittances go towards pulling people out of the river, right? So how can we do some of that a bit ahead of time, so then remittances can be used for other things such as investments and innovation. So we'll continue having this conversation. So please keep an eye out for our next webinar with Opella. And then of course we are going to also have a LinkedIn Live around Beyond Remittances next week as well. So if you want to know a little bit more about our overall Beyond Remittances strategy, I invite you to our LinkedIn Live that's happening next week. And then also, we are announcing it here first, so you guys get exclusive info, but please save the date for March 25th to the 27th. We are going to be having our African Diaspora Investment Symposium in Silicon Valley, and the topic is actually on healthcare innovation across Silicon Valley and the African continent. So I think everyone in this room is going to be very interested in the topics that we are going to be covering at next year's ADIS. So consider this your official invitation. Please save the date. You're hearing it first. We haven't shared this outside of the team yet. So congratulations. I hope to see many of you in Silicon Valley, March 25th to the 27th, 2026. So yeah, that's everything I have for you all. Thank you again to Opella. This partnership means so much to us. We are so grateful to you. Thank you to Greg, Dr. Moodley, Professor Hassani, Chibuzo, Deepa. Thank you so, so much for your insights, for your preparation, your effort, and your time. And thank you so much for the attention of our audience. Take care, everybody, and have a lovely evening, day, afternoon, whatever time zone you're in. It was so funny putting together the poster for this event because we had like all the time zones. So thank you so much to everybody. Thank you. Thank you.